Hello everyone, I am Dr. P.S. Vamseedhar, consultant nephrologist and transplant physician at Apollo Hospital, Visakhapatnam. On the occasion of World Kidney Day, I wish good health to all of you. Today, I would try to sensitize you about the importance of increasing the awareness about kidney problems. Why is it so? See, first of all, I would like to tell you briefly about the World Kidney Day. Every year, second Thursday of March will be celebrated as World Kidney Day. And the main motto behind this is to increase the awareness and spread the awareness about the kidney problems worldwide. So, is it really this important? Is the kidney that important? Obviously, yes. So, for that, to know the importance of this, we need to answer three questions. First of all, is it common? What I mean is, are kidney diseases common? Second question is the prevalence of kidney disease increasing? And the third question is it dangerous? Is the kidney problem dangerous? And unfortunately, the answer to all these three questions is yes. And this year's motto or theme of the World Kidney Day is Kidney Health for All, and it is self-explanatory. So coming back to our questions, is it common? Obviously yes. If we see the statistics, if we see the studies, not only from India but also from other countries, we can see since the past 10 to 15 years, the kidney problems are increasing. The incidence and prevalence of kidney problem is increasing. For example, if you take in our country, out of every 100 people, at least 10 to 15 people do have some kidney problem or the other. Some might have high creatinine, some might have protein leak in the urine, or etc. etc. And the second question which I asked is the kidney problem increasing? And yes, as I told you earlier, studies have shown that in the past decade or so, there is an almost 40% increase in the incidence of kidney problems. Well, I have to say that it is driven mainly due to the increasing prevalence of diabetes. As all of us know, the people with diabetes, the population with diabetic population is increasing by leaps and bounds. It's an epidemic. So as kidney problem, kidney disease also is an epidemic now. Okay, you might ask, is it increasing? It is increasing, yes. So why should we be concerned about this? Is it dangerous? That's the third question. And the answer is an emphatic yes. Kidney problem is very dangerous because if we do not identify it in an early stage and if it progresses to an advanced stage, people will end up in complete kidney failure, thereby requiring dialysis or kidney transplantation. And it is not only about the kidney. And whenever anyone has kidney problem, the increase in the toxic products in the blood leads to problems in other organs also. And the most common problem is heart. So if you see, similar to diabetes, any person who has kidney problem has a high risk of getting heart disease. It can be heart attack, or we call it as coronary artery disease, or it can be heart failure, or it can be anything else, arrhythmias. So in fact, one of the common causes of death in a patient with kidney problem is heart disease. So similar to heart, even other organ systems also can be affected because of kidney problems, right from the brain, lungs, gastrointestinal tract, and so on and so forth. So it is very dangerous if we do not treat it properly. So as I told you, kidney disease is common. It is increasing in incidence and also it is dangerous. So based on these three things, we have to understand that it is of utmost importance to increase the awareness of kidney problems in the general society. Okay, what can we do about this? So the first thing is prevention. For any disease, prevention is better than cure. That's the universal law. Okay, so there are some steps. There are some situations where we can avoid getting kidney problems. Like for example, first thing, we should lead a healthy lifestyle. That means we should avoid smoking or alcohol. We should eat a healthy diet, more of greens and fruits and vegetables. We should avoid getting obese, and as far as possible, we should try to avoid becoming a diabetic or hypertensive. Cut down on sugar, cut down on salt, and do at least 30 minutes aerobic exercise per day. So this holds good for any lifestyle disorders, be it diabetes or hypertension or kidney problem or cardiovascular. So that's one aspect of preventing the kidney problem. And the other things which are important are, suppose if anyone who is diagnosed to have diabetes or hypertension, they should keep their blood sugar levels and blood pressure levels under very tight control. And they should properly follow up with their physician or endocrinologist and make sure that their blood sugar and BP are under control. That's one way of preventing the kidney problem. Okay. And some other points which I feel like which are important are, we should be very careful in using painkillers. But unfortunately, most of the people, they take it very lightly. Okay. Once they get any knee pain or back pain, they just go to the nearby pharmacy, buy the painkillers, and they use it like for sometimes for weeks, for months, and some of our patients, we see they use it for years, and finally they'll end up with kidney failure and they come to us. So this is an avoidable problem. We feel very bad, very sad by seeing such patients. It could have been completely prevented. So please avoid using painkillers. But there are certain situations where we have to use. In that situation, use it under the supervision of a doctor and use it for as minimum number of days as possible. And the other important thing, especially in our countries, is we should avoid dehydration, especially in summer months. Ours is a tropical country. India is a tropical country. So we do have a lot of heat in summer. And even we don't know that lot of water gets evaporated from our body. So we should always stay hydrated. We should avoid dehydration. At least make sure that we drink around 3 to 4 liters of water per day in summer especially. So these are certain things by which we can prevent kidney problems. And also unnecessary antibiotics and unscrupulous antibiotics. We should be very careful with any medicine which we use. Please do use your medication only with the supervision of or with the advice of a doctor. So first step, as I told you, is prevention. The second thing, how to retard the progression once we get the kidney problem, or how to identify it in early stage. So are there any advantages by identifying it in early stage? Yes, because there are some kidney problems which can be treatable if we identify them at the proper stage. At the same time, if we leave such problems or if they are neglected, once they become, they progress to a more severe stage, they will go into a point of no return. So there are certain diseases which we can identify. If we identify them, we can treat those. So how do we know? How do we identify them at the early stage? Some people do develop some symptoms. Some people do not develop any symptoms. Common symptoms of kidney problem are swelling of your body, that includes face or feet, okay, and any problems, any complaints with regard to your urination, reduced urine output, or in some situations, especially in the early stage, people do complain about increased urinary frequency, especially at the night. That's an early symptom of kidney problem. And some people, they pass blood in urine or they pass stones in urine. Some people who do get repeated urine infections, they are also more prone for kidney problems. And uncontrolled diabetes and hypertension, these are the commonest risk factors for progressive kidney failure. So apart from the earlier symptoms which I told you, other symptoms, other non-specific symptoms like loss of appetite, unintentional loss of weight, or repeated vomitings or nausea, or generalized weakness or fatigue. We would say that like, Dr. Saab, we are getting very tired even for our routine activities, or unexplained anemia. These are all the possible symptoms and signs of kidney disease. So if you have any of these things, along with the other necessary tests, also get tested for kidney problem. And some people, they do not have any symptoms. Unfortunately, they do not have any symptoms. So we identified Actually, there are certain set of populations with the risk factors for kidney problem. For example, age above 60, or people who have diabetes, or people who have hypertension, people who have repeated use of painkillers, people who have some autoimmune problems like SLE, etc. People who have repeated kidney stone problem. So such people, even if they do not have any symptoms, they should get checked up for kidney problems at least yearly once or twice, much more better. So we should screen for kidney problems in such high risk people. And the other point is, once if we are diagnosed to have any kidney problem, we should be under follow-up with a nephrologist. Once in 3 months or once in 2 months, depending on the severity of the problem. And we should follow the guidelines. So these are all the steps which will help us, if possible, to prevent kidney problem or to retard the progression of kidney problem. Finally, I would like to say, this bringing awareness about the kidney problem is a collective effort. It's not possible only by me or by, it's not possible by certain individuals. So if you feel responsible, please do share this video with among your known circles. So that will help in increasing the awareness about the kidney problem, and you will be doing some good to the society. Thank you.